Hi, everyone. We're going to be going over the S5 case study from the S5R5 manual. And the first thing we're going to do is go through the fitness screening. And what I want to point out on the fitness screening are the important points that the client has stated that are his goals and what he wants to accomplish. And then we'll go through the fitness assessment, and we're going to work a little bit backwards in this particular case so that you have a sense of where the client is going. So we'll get to that in just a moment, and I'll explain. So we have Larry, who's a 40-year-old male, that is presenting himself for a Polestar Pilates fitness test. He has a health history of low back pain on and off for the past 10 years, and it's getting worse after sitting for long periods of time. He has repetitive ankle sprains and occasional left knee pain, and he's also a recreational athlete that who participates in running 5Ks 2 times a week, and he surfs in the summer. His personal goals are to run a half marathon in 6 months, and he wants to eliminate back pain and left knee pain. So we want to certainly include those in our problem list as activities that we want him to return to. Okay, so the first thing I want to mention is the half squat test, for which he scored a 2. In the notes out to the side, you're always going to put what is the reason why the client did not score a 3. So if the client scored a 1 or a 2, you're going to put in the sidebar there why they did not score a 2 or a 1, or why they did not score a 3. So this particular man was not able to reach the 45 degrees, and what that means is he was not able to reach past the 45 degrees of knee flexion that we're looking for, and his heels elevated. So how did you write that as a problem in your case? Decreased flexibility in the calf. Okay, could it be anything else? That's right. It could be decreased ankle range of motion due to joint pathology or just limitation in the joint. The shape of the joint, sometimes the shape of the talus, limits ankle dorsiflexion in your client. So you know that he's limited in ankle dorsiflexion, but you don't exactly know why, because you haven't really done a gastroc soleus test on that. So you can put decreased ankle dorsiflexion in standing. He didn't say he had any pain with that or any other alignment issues, so you can't really assume that. On the next test, we have the full squat. He has poor alignment of the left leg. So there you do have an alignment issue. But what we would like for you to actually look at is, what is the alignment fault? Does his feet pronate? Did he have valgus? Does his knee track way forward over his foot? It's whatever it is that was the movement fault. If you can be more specific, you'll be able to generate an exercise program that's much more specific to the client's needs other than poor alignment. It could have been varus, it could have been supination. So you want to actually put what it is instead of just poor alignment. So we're going to assume that he has valgus and say pronation. If when you did your case study last night, you put something else, that's fine. Whatever you made the assumption of the alignment issue is fine, as long as you can justify it. So let's think about exercises that would lead this person to score a 3. So what exercise needs to be in his program for him to score a 3 on the half squat? Assisted squats would be a good one. So we know that if he's doing it well, he may be able to score a 3. What are some other exercises that may help us figure that out? Yeah, but just because somebody can do footwork really well, that would be a precursor to having them do it upright in a vertical posture. So that would go earlier on in the program as a progression to the assisted squats. So we want to have something that simulates that exercise as closely as possible in our advanced program. Does that make sense? So that I want to see assisted squats either in the intermediate program or the advanced program. I wouldn't have it necessarily in the beginner program. Footwork, however, would be in the beginner. So standing leg pump could be in there. And what about forward lunge, side lunge, things like that? Those could be in there as well, because you don't want to just be locked into one exercise. All right. Then the full squat. Pretty much the same exercises, right? Especially the forward lunge and the side lunge, because you have to keep the torso vertical, and it requires a lot of lower extremity awareness and alignment. Does that make sense? Okay. Heel raise. What exercises are we going to want in the program? So we might want footwork in there, but does that guarantee that he can do a heel raise? Footwork is much less than body weight. Yeah? So what's another exercise might we want to include in the program? What's that exercise called? Achilles stretch, yes. Achilles stretch could be in there, and we could certainly take him to a position where he's not leaning on the chair with his shin and take him into a vertical posture and have him do standing leg pumps like that. We could also have him do the standing leg pump where he's going up on the back foot, the foot that's on the floor. So we could bring him what we call up onto releve or into plantar flexion so that he's doing plantar flexion activities on the standing leg, not on the leg that's on the pedal. Yeah? Okay. So one of those exercises would be great to have in there. Goal post. He scored a 3. So what does that mean? He has good shoulder mobility and external rotation. He probably has good chest wall length, and that he has good shoulder abduction and flexion. Yeah, it's more like a scaption position. It's not a pure flexion, and it's not pure abduction. Okay, long sit. He scored a 1, and he could not sit in long sit at all. So that probably means that he's sitting like this with this rounded back, right? So what does that lead us to state in our problem list? What's the problem? Yeah, it could be decreased hamstring flexibility, but what else could it be? Decreased hip range of motion. What else? One other thing. Could be, but we're going to find out about that in later tests to see if it's that. So, but that could be in the back of your mind as you're thinking about it. But what other tests are you going to look at to see if he has decreased core control? Yeah, the hundreds. You know, you might watch him do the 100 to see if he has poor core control. All right. So what else in the long sit are we looking at? So what if somebody did a long sit and they pulled their toes back into dorsiflexion? What are we looking at there? Yeah, but that's probably not going to limit his hip range. Neural tension, yes, of the sciatic nerve. So that also, especially with this client's history of back pain, he may have some neural tension that you'll have to kind of address. Doesn't mean you're going to treat it, but you're going to honor it. And so we're going to be looking for it to see if it's a problem. It doesn't say that he had pain down his legs here, but I just want you to be thinking about these things in the back of your mind as you look at these tests. So long sit could be decreased hamstring length, could be neural tension, and it could be decreased hip mobility. Yeah? He could have very weak hip flexors as well to hold him up in that position. Okay. So seated hip abduction, he scored a 2 because he had less than 130 degrees range of motion in the hips. So what is our problem for that one?
Hip capsular restrictions and decreased flexibility of the adductor.
Right. Right. So he could have a hip mobility issue in the joint, or he could have decreased mobility in the hip adductors. Okay. So I'll stop for a moment and write those on the board. Heel raise, he scored a 2. So that was decreased. What did we say that was? We said what exercises we do, but we didn't say what was happening with that. What's the problem that you put here? Yeah. Decreased calf strength, right? And we don't know at this point if it's the gastroc or the soleus or both. Okay. Long sit, goal post, he scored a 3, so we're not going to put a problem for that one. Long sit, we said he has decreased hamstring length or hip mobility. Okay. And then seated hip abduction, decreased adductor length. All right, and then with Z-sitting, he scored a 2, and it says both hips are tight in this one. So how will you write a problem for that one?
Decreased range of motion.
It doesn't have to be capsular. It could be the small rotators around the hip that are tight as well. It doesn't have to be capsular. You'd have to use your physical therapy skills to figure out whether it's capsular or muscular. So we're going to say decreased internal and external rotation. So that can be either muscular or capsular. All right, and then the roll up, and we're going to say bilaterally on that one. And then the roll up, he scored a 3, which interesting. Wow, that's pretty good for someone with low back pain. And then the 100, he scored a 3. And the side lift, he scored a 3. And the push up. So he scored a 3 in good spine articulation. He has good core control in the supine position. He has good stability of the scapula and the torso in the side lying position. And he also has good scapular stability and core control in the prone position. So he's doing pretty well there. Superman, he scored a 2 because he could not clear the thigh and the chest at the same time. So how would you write that as a problem? Okay. How do you know that? How do you know if it's back extensor strength or thoracic mobility? Right? You got to know if it's one or the other. You just know it's decreased thoracic extension. You don't know if it's strength or mobility yet. Okay? So let's put that. We may be able to define that later when we get to the next test. So what else do we have a decrease in with this, according to this test? Hip extension. We don't know if it's quad, right? We have a test for that, so we'll find that out later, but we don't know yet. So we have decreased hip extension. All right. And then prone shoulder flexion, he scored a 2. So there's no note out to the side, so you can just look at your fitness screening descriptions as to what lends itself to a 2. And what do you have here for your problem? For the prone shoulder flexion, he scored a 2. So how do you write your problem for that one? Because if they're not scoring a 3, you got to have a problem for it so you can address it. Right. So he can lift the arms off the ground in a prone position, but he just doesn't do it with good form and alignment, right? Because otherwise we'd have to put him supine and see if he could even bring the arms overhead, right? So we're going to say decreased shoulder flexion in this one. Prone press up, he scored a 2. And here we see that he has poor thoracic mobility. So we really don't know if that mobility is limiting his strength in those thoracic extensors. So poor thoracic mobility is also here. So we already have decreased thoracic extension here. So we have 2 check marks for that. That's going to be important to note. Prone knee bend, he scored a 1 because he could not reach either foot. So what does that mean for our problem list? It's not hamstring, it's decreased hip flexor mobility, right? So if he can't reach either foot, he didn't even begin to extend his hip yet. So we don't know if it's rectus femoris or if it's just the quads, one of the shorter quads that don't cross the hip joint. So we're just going to say decreased knee flexion. Or you could say quad length too. All right, so let's go back for a moment and look at exercises that are going to address these issues that you're going to want to have in your program. Because this is what I do when I'm looking at your programs is, did you address all of the issues that they have by the selection of your exercises? So I know that you've achieved those goals by what exercises you've selected. All right, so we've already said we want to have spring-assisted squats and or forward lunge. We want to have Achilles stretch. Side lunge could be in there as well. And then hamstring length. What kinds of exercises do I want in there? So that I know if he's doing this exercise perfectly, that he's going to score a 3 on this test. Those are not done in anything close to the same position as this. So I want a neutral spine with a hip hinge forward to tell me that he can sit up tall in those positions, because those rounded exercises are going to be more of a roll-up type exercise or spinal articulation exercise with both spine flexion and the hamstring stretch. So don't be confused by the name hamstring, because that was Joseph Pilates' name, and it doesn't mean that that's what the exercise focus is, right? So you don't want to get confused by that. So what I want are exercises that have him seated upright, or it could be in another position, but that he can at least achieve a 90-degree angle and maybe even go forward a little bit more than that, right? And hamstring 2 and 3 and 1 are not going to make that happen. And the other thing about people with back pain that have very tight hamstrings and also very good roll-up ability and good articulation of the spine, the hamstrings will continue to pull on the pelvis as you roll forward so that you're increasing mobility even more in the low back and in those posterior structures. So it's putting him more at risk for disc pathology, right? So he doesn't need more spinal articulation. He needs more hip disassociation type exercises. So we'll talk about that later. So give me an exercise that's going to address that. Feet in straps, yeah. But that's a rounded exercise again, spine stretch. Yeah. There are, you don't have to make an exercise up. There is one that has this exact position. You're talking about footwork on the trap table. Yeah, that could help. Yes, seated push through. It's right there. Go up and you're hinging forward. No, there's a component of it, not this part, but this part where you push the bar upright, and your goal is to get into that lengthened spine position, hinge forward at the hip joints. Yeah. There's also stomach massage in the vertical position with the reach forward that you just did this weekend. Yeah. Okay. So we know we want to have something like push through with the shoulder flexion or the stomach massage reach forward. Yeah. With that neutral spine. But you really need something in neutral that addresses that. Okay. So we're going to say push through. The stomach massage, because it doesn't have the assistance of the bar, would be one that if he did well, that I would know he would get a 3 on that test, because the bar is actually assisting him. But you're definitely going to want that in his program to see if he can actually do this activity. Okay, adductor length. So how are we going to address the adductor length? What exercises are we going to choose for him? Saw is not an adductor stretch. Right? Saw is only the width of the mat. You only hold your legs at the width of the mat. It's more of a spine rotation and flexion combined stretch. It's more of a spine movement. But what is more of a hip movement in our program? Hip opener. That'll do it. That'll definitely do it. So hip opener could be in the program. What else? We already had something here that would help address it. What exercises do we have in the program that abduct the legs? Not push through. Yeah, spine corrector leg series will do it. Horseback doesn't widen the legs apart. It's a pretty narrow position of the hips. It's not going to improve him to that 130 degrees. It is an adductor exercise, but it's not going to get him wide enough to achieve a 3 on that test. Yeah, but that leg is not straight. Hint, hint. What exercise is done in this position? Ladder barrel. The teacher. I know you can't stand it. No, mermaid is not. What exercise is done in the exact position I'm standing in right now? I know, I'm just trying to show off my boots, you know. The leg stretch series on the ladder barrel. Yeah, I'm trying to get you guys into the right nomenclature so that you remember these names. Okay, yeah, standing leg stretches. What else? Feet in the straps. How about that? That's the seller of every Pilates program. If you put people in feet in the straps, 90% of people are going to sign up for the next lesson. That made me sign up for the program. I was like, I'm writing a check right now. I want to sign up for whatever you guys are doing because that was amazing. So you could have feet in the straps. You could have leg stretch series on the ladder barrel. You could have the leg series on the spine corrector. You could have hip opener. So I want to see that something is in there that's going to address this decreased adductor length. Okay. All right, now internal rotation and external rotation is limited. How are we going to have an exercise in there that's going to address that? Mermaid. Pretty much mermaid's got to be in there somewhere because that's the only one that actually addresses internal rotation of the hip. Where else do we have internal rotation of the hip in Pilates in our program? You can have it in footwork. That's pretty much it. There's no other place that we have internal rotation. You do internal rotation with feet in the straps, but there's not a lot of places that improve internal rotation other than the mermaid. You could also do the leg stretch series on the ladder barrel for the external rotation component of that part. Okay, so I definitely want to see a mermaid in there, and you could also have the leg stretch series in there. Thoracic extension. What exercise do you need to have in there that's going to show that he can perform the Superman and the Swan correctly? So prone press up would be one of them because that's exactly what the test is. Scarecrow would be one, absolutely. What else? Scarecrow is good because it's going to test shoulder flexion and thoracic extension at the same time. Any other exercises you can think of? Because Swan is assistive, which we need that. We need thoracic mobility and extension with assistance, but we also need it without assistance with the arms overhead for the Superman. Yeah, so swimming. The good news about swimming is that's going to also address hip extension. So you get 3 goals met with one exercise. That's the cool thing, is that you can, if you pick one exercise that achieves 3 goals, definitely providing more efficiency in their program. So you got shoulder flexion, thoracic extension, and hip extension with swimming. But you don't have to have swimming in there. You could have something else if you wanted. Okay, so all these can be addressed by swimming. But again, you could also have Scarecrow in there, and there's certainly other exercises for hip extension. Okay, so now we're going down to knee flexion, and we're trying to improve quadricep length so that he can reach his foot behind him. What exercise might do that?
Thigh stretch.
Yeah, thigh stretch would be a good one. So we'd love to see thigh stretch in there. Okay. What else?
Single leg kick.
Single leg kick. That's a good one. Absolutely. They've got to control the pelvis and bend the knee. Yeah. What else? There's a couple other ones. So what about the leg stretch series on the ladder barrel? Is there a thigh stretch in that one?
Yeah.
You can turn around, put your foot on the barrel, and do some lengthening there. Okay. Very good. Does that make sense to you? It's like where this helps you figure out where you're going and what exercises you'll need to have in the curriculum to address these goals, right? It's not really a prescription, but it kind of is. It kind of gives you some guidelines for what you want to look at. The other things that you would consider would be what sports activities they're doing. Okay, so we want to see what does he do as a sport activity. He wants to run, and he wants to eliminate his back pain and left knee pain, but he also surfs, right? So he wants to run a 5K, or no, a half marathon in 6 months, and he wants to get back to surfing. So surfing is going to involve this swimming position. He needs to be in thoracic extension. He needs to be able to rotate as well and to improve his shoulder flexion mobility. So that's going to be really helpful. And hip extension. So what are some exercises that might simulate the pop-up of surfing? So, well, yeah, but I would say something like leg pull, knee stretches is going to simulate the pop-up, getting your feet underneath you. You've got to pop up. You've got to push yourself up into a little bit of thoracic extension, but with core control. So like down stretch and then doing some knee stretches might be great in his program too. So I'll be looking for things that help you simulate his sports activities and also his goals here. So you don't want to forget about the sports activities as you're putting his program together. Okay, so the next thing we want to think about are where do we start? What's the first priority? So how is it that we establish our priorities? How do you establish the priorities for a client? Like where do you start? He's got a lot of different problems here. How do you prioritize where to start? With the ones, absolutely. So let's look at what his ones are. He had a 1 in the long sit and a 1 in the prone knee bend. So what does that have in common? Range of motion, so lower extremity mobility at the hip especially, and this may be, at the knee, but it's more about the quadricep there. So we want hip disassociation for this man. He already has really good spinal articulation, so we're going to focus more on neutral exercises that accentuate hip disassociation. And we're going to get some mobility in the hip, because he also scored poorly in the Z sitting position and the abduction. Not poorly, but he had, less than perfect scores in those actions. Okay, so we're going to start with, so if you had to circle 2 or 3 goals here, what would you start with? So where are my stars here for my priorities? Thoracic extension. Why thoracic extension? It's got 2 check marks by it, right? Yeah, that helps, because that was 2 particular tests that he did poorly in because he has poor thoracic mobility. All right, so we're going to think of things like all of these. He wants to run, right? And all of these lower extremity problems here. So these would definitely want to have some addressing of the lower extremity issues. We're not so worried about core control, but what we are worried about is core control along with some hip disassociation. So we're going to think of things like these alignment issues that he has and the hip mobility. Okay. Adductor length is, probably could be a problem, but it's not really going to affect his activities of choice, his surfing and the running activities. Definitely hip extension is going to be important too, if he's a runner. Okay, so I just kind of go through and think about, what are the priorities? He wants to run a marathon in 6 months, so that's going to trump the surfing. So I might address these things later, like the shoulder flexion. I want to get better thoracic mobility before we start working on shoulder flexion, because that's probably why his shoulder flexion is limited. Okay. All right. So let's go into a program. So we had a volunteer that gave her program to us, and what I'll do is I'll erase these because you have these goals, right? And we'll start with the beginner program and see how it looks as far as addressing all of these goals. All right. So beginner program consists of mat bridging, arm arcs, footwork on the reformer, reformer bridging, supine stretch on the spine corrector, prone press up on the mat, chair double leg pump and Achilles stretch, and trap table swan with one leg off the table, and ladder barrel standing leg stretches. Look at that. So we already know that she's addressed some of the problems that we talked about, because we wanted Achilles stretch in there, we wanted a swan in there somewhere, right? We wanted leg stretches in there, we wanted the prone press up. So we know that she's already addressed some of the goals that we had. We wouldn't expect that she's going to address every one of the goals in the beginner program, but hopefully a majority of them are there. All right, so let's look. We're going to apply the filter system. So the first thing I do is I count how many exercises she has. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we need 8 to 10 exercises in her program for the beginner. Filter, done. Now we're going to look to see, does she have an exercise on each piece of apparatus? So she has mat, reformer, spine corrector, chair, and trap table, as well even a ladder barrel exercise. So she's definitely got that. So all apparatus is there. And now we look to see if she's achieved the goals that we were setting. All right, so bridging. So what was the purpose of selecting bridging? in his program? What goals could that achieve? He didn't necessarily need spinal articulation. Doesn't mean you don't want to do it. But what goal would bridging achieve? Give you some hip extension. Yeah, so I like that for hip extension. So that's fine for hip extension. That looks good. Now, arm arcs. What goal does that achieve? But that wasn't one of our goals. Shoulder flexion, right? So shoulder flexion. He's starting with some simple activities for shoulder flexion. We didn't prioritize that right away, but that's okay to have it in there. Footwork definitely addresses that lower extremity alignment issue, right? So lower extremity alignment. And then reformer bridging is, I would say it's a repeat. So I wouldn't necessarily, there's so much to select that I wouldn't necessarily repeat bridging on another piece of apparatus. You might do it the next session on the reformer in the intermediate program. So I would nix that because we're going to put something else in there that might be more useful later. Okay. Doesn't mean it's wrong. You could certainly teach bridging on the mat and bridging on the reformer in a session. But this is a theoretical framework for how to think about putting a program together that meets all of the goals. Okay. It doesn't mean this is exactly what's going to happen in real life. Yeah. Okay. So supine stretch on the spine corrector. What goal does that achieve? Yeah. So thoracic extension. That one's definitely a necessary one. And we said prone press up achieves the goal of the swan. And I love that she selected the supine stretch on the spine corrector as a passive mobilization on the equipment before she turned her against gravity and prone, even though it's assisted as well. But this person didn't score well on thoracic mobility or extension, so he does need assistance with this. So I like both of these together like that. That looks great. Chair double leg pump. That was fine because we need lower extremity alignment. We need him to be upright. We need him to practice hip disassociation. So I think that looks good too. We certainly wanted Achilles stretch in there to address the calf strength, right? So, and then we could have him come away from the chair to practice his upright posture. So now we've got the swan with one leg off the table. Okay, what is the issue here that might present a problem for him? Yeah. The swan on the trap table is a great choice, but it's too soon because he's got to be able to score pretty much a 3 in shoulder flexion in order to do that. Yeah, or he might need some introduction first. So I like that you have the arm arcs here, but he might need something that's going to be a little bit less aggressive in that. Yeah.
So back in the testing, when he passed the goal post,
Yeah.
he was able to come up.
Right.
So I thought he had the range of motion in the shoulder flexion. So
That's right. You're right about that. So if he's doing it with bent arm and then pressing forward and he's doing it only on one side, that I agree with you. So yeah, and this is what I want you to do is help me justify the selections that you've picked and why you've picked them.
So it's not really a range of motion situation, maybe more so a strengthening.
Maybe it's strength. Yeah. Yeah, because he could get the goalpost against gravity in that position. Yeah. Yeah, and I think probably the thoracic extension is the issue more than anything. Yeah. So yeah, if you can justify why you put it there, that's great. That's all I need to know. Okay. Leg stretch series, we certainly wanted that in there. We'll be focusing on the external rotation, the hamstrings in the forward position, the side position with the adductors, and then turn around and do that. So we could do a lot of different positions with this exercise. So this could achieve a lot of our goals. Okay. So let's see what is missing that we could put in here that might be a better choice. So we needed the vertical postures. So we've got something in standing here. We've got the Achilles stretch that would also be in standing. We've got a long sit here. So we could use this as our long sit goal with the leg stretches, with the legs sitting straight ahead. Yeah, what about the Z sitting? We haven't addressed that yet. We've pretty much addressed everything except the Z sitting, right? It could, yeah, it could, absolutely. So what else are we going to want him to be able to do that we need to progress him towards? Yeah. Any. Yeah, I'd like to see the mermaid in here because it's going to take a while to get him to the point where he can do the full mermaid. Where would you do the mermaid? You could do it on the chair with the leg in that externally rotated position, yeah. But on the mat with a prop, I wouldn't necessarily put him on the reformer. That's a lot to deal with. I think that is more of an intermediate exercise. I don't think of that as a beginner exercise because there's a lot going on with the upper body and the organization. So I think I would love to see mermaid on the mat here, and then we could just move it to here. And he could even just address the lower body issues. You could prop him a little bit, sitting up on a couple of mats stacked up to help him with working on that rotation. Okay? Otherwise, great program. I think it looks really good. The other things that we're looking for are, do you have 4 or 5 weight-bearing exercises in a row in the upper body? You know, we don't want you to have that. So that if you did the program, does it flow from one to the other and there's not excessive movements repeated throughout the program? Okay? All right. And it's an overall body exercise program with all the categories fulfilled. And they don't have to be in order. So you're generally starting with supine supported exercises, progressing to standing, getting them ready to go out the door. Yeah? And then somewhere in the middle of the program are your spine mobility exercises, and your more movement integration exercises come in like the beginning of the last third of the program, so that you've built up to doing the movement integration and putting it all together for them. Okay? And you don't want to end the exercise program with just the hardest exercise, because they'll be fatigued. So you want that to come sort of to the end of the second half. I mean, the end of the second third of the program, or the beginning of the last third. Okay? All right, now let's look at any other questions or comments? Did anybody else have other exercises they liked in this program? Feet in straps? Yeah, that would be a good one. You could have switched that to feet in straps. That would have been a good one for here. Yeah, if you didn't do mermaid. Okay, so let's do the intermediate program. So we had reformer feet in straps. There we go. So we don't need it in this program, if she had that. And we had supine arm series. And trap table thigh stretch. Looks good. And trap table assisted squats. Looks familiar. Mat quadruped. Ladder barrels, supine stretch. Chair, swan with rotation. Chair, standing leg pump. Mermaid on the mat. Reformer long box in prone with the shoulder press and extension. Reformer knee stretches. And reformer scooter. All right. Okay, so we're starting with feet in the straps, which I think is a perfectly appropriate exercise. I think this would have been challenging to start with in the beginner program because he was so limited, but I think this one, we might want to increase the spring tension with this one, but that's a great choice. The supine arm series, I think, is great. He was only going to go to 90 degrees on that, and then you could progress him to doing more of the abdominal series because he had a 3 on the core control tests. So I would even push him to going into the supine abdominal series here to give him more of a challenge. Yeah? And then the thigh stretch, we already said that was something we wanted in the program, so certainly a great opportunity to do it here and a good time to do it in the intermediate program. He probably wouldn't have enough hip extension to do it in the beginner program, so this is the right place to put it. The spring assisted squats, we certainly wanted in there, so that looks great. That achieves our lower extremity goals. However, mat quadruped, what's wrong with that choice? It's fine, but he had a 3 on the push-up, so he doesn't need quadruped. He's way beyond that. So we'll just cross it out for now, and we'll put something else in there that we may need. Yeah.
Just some quick
Yeah.
You still need to do mat quadruped first, right?
Not if you did a 3 on the push-up.
Okay.
I'd go right onto the reformer and say, go into quadruped. Does that look okay? Great. Let's do it. You know, and you don't want to give him baby stuff. I mean, this guy's 33, I think. No, he's 40. He's a surfer. He's a runner. You don't want to make him just be in quadruped and breathe for 15 minutes. You know, they're not going to come back. And they may be the kind of person that wants all those details and wants that. No, because if they scored a 3 on the push-up, you can move forward. Because the point is, with these assessments, is to get from point A to point B, which is their goal, as fast as possible. That is what's going to set you apart from other Pilates teachers. That you're not just giving people a cookbook, that you are actually assessing the client and challenging them at their level. Does that make sense? Because that's what's going to make you a more effective teacher. And you're going to get them to meet their goals a lot faster if you select the right exercises based on your assessment. So I would just go fly right through quadruped and give him the reverse abdominals, or we'll see what we should put in there. We'll decide what's missing in a moment. And there may not be anything missing. We could just give him a bonus exercise, right? All right. So ladder barrel supine stretch, perfect choice here. That's going to give him that thoracic extension and shoulder flexion mobility, and a great time to do it too, because he's going to be more mobile and ready for it, because he's done the spine corrector supine stretch, which is a little more basic. He's also done the swan to help him with mobility. All right. Chair. Let's see. Chair, swan with rotation. That's fine, because that's a lot like the surfing that he's going to be doing. I think that's a great choice. Chair standing leg pumps, we said we wanted in there. And he could be doing a little more challenging variation standing on the rotating disc or elevated on one toe. Mat mermaid, we certainly said we wanted that in there, and we kind of stuck it in here, but that's fine if you have it here. So I'm going to leave it. I think that was fine that you have it there. Long box in prone, he's going to do the shoulder press or the shoulder flexion and the thoracic extension. That's a great choice. Knee stretches, we already said that simulates his surfing pop-up earlier, and so we already had that in our mind as something we might want to have in the program. So that I think because he scored a 3 on the assessment, that's fine to have it here. If he had poor core control and poor scapular stability, I would want it in the advanced program if he weren't didn't score so well on those tests. I love that Scooter's in here, because Scooter is going to give him that hip extension that we're looking for, and it simulates running. So he could do it without hands as he progresses. He could, also do the hip extension stretch prior to doing the Scooter as well. So I like this program. I think this looks really good. It progresses through the categories, starting with supine, having some spinal mobilization, some upright exercises, and then ending with standing exercises to integrate out the door. Okay, so if anything is missing, we've got the long sit and abduction here. We've got the supine arms and abdominals here, which is probably not really achieving any of his goals, but it's a great challenge for him and a great flow, which is fine. We needed thigh stretch in there. We needed the assisted squats in there, and that achieves all of those lower extremity goals that we had. And we have thoracic extension passively. We don't have anything active yet. Everything is thoracic extension with assistance. So what I think we need in here is something with no assistance. So what exercises might you stick in here instead of this quadruped to challenge him? You could do the pulling straps. Yeah. After you do the supine arms, or after the supine stretch? Or the long box. Yeah, you could do pulling straps. Okay, so that's an option. There's always more than one way to do it. What else could go here? Because he needs a home program. He's got mermaid. So scarecrow might be a little challenging for him. Dart, yeah, I'd love to see dart, because that's a thoracic extension exercise that it doesn't involve the shoulder flexion yet, and he can start to strengthen. Yeah, so I think that's a great intermediate exercise for him. Okay, but otherwise I think we have everything in there what we need. All right, so now let's go to the advanced program. Well, before we do that, let's look at the progression from one to the other. So what was our progression to feet in the straps? What helps us with that? Did we need a progression necessarily? We needed a little bit, right? So we had footwork. What else did we have here? We had the leg stretch series that is kind of going to give us some hip mobility, but it's also in standing. But we don't necessarily need that much of a progression here. We don't really need, we have the supine arm arcs on the mat, taking him to the reformer, and then we said we're going to add abs. The thigh stretch, how do we prepare him for this one? The leg stretch series, yeah. He might have needed a little more hip extension before doing the thigh stretch, because otherwise it's going to pull him into that lumbar. The swan could help him with that, yeah. So really thinking about, I need to make sure I'm doing some hip extension. So he could have had something like scooter in the program, the first program, but it's absolutely fine. Okay, so let's see, dart. We prepared him by doing the supine stretch, which helps with thoracic extension, and the prone press up. So then we turn him over against gravity. He's got a little more mobility in that thoracic extension, and maybe he can access that a little bit more. So we did prepare him for that. The supine stretch, he was prepared with this one, with the supine stretch on the spine corrector. The swan with rotation. He already scored a 3 on the push-up, so we're just adding that rotational component to help him with that. So that was fine. He didn't need necessarily much preparation for that. The standing leg pumps on the chair. He didn't need a lot of preparation for that either, otherwise, but he did have footwork on the reformer that's going to help him with that. Mermaid, we talked about that being either here or here. There's not a lot of preparation for mermaid. You know, we did a little bit of stretches here. We might be doing some hip disassociation to help him with that. Long box and prone. That's again assistive exercise, doesn't need a lot of preparation. Pulling straps, but we did prepare him here with the supine stretch and the prone press up. We said pulling straps might be an option, or dart, you know, so we've prepared him with thoracic mobility. The knee stretches, again, he scored a 3 on his push-up, and we're just adding that dynamic component in that quadruped position. Scooter, again, we've prepared him with the standing leg stretches and making that more dynamic. So I think our progressions are fine, because that's what we're looking for. Did you jump from one place to the other without preparing the client? All right. Advanced program. We have trap table parakeet, breathing, and hip extension on elbows. We have the mat leg pull, mat side lift, ladder barrel, back to forward bend, ladder barrel bridge, ladder barrel swan, chair, hamstring 2, chair lateral flexion, mat swimming, reformer semicircle, reformer mermaid, and side splits, and hip stretches in standing. Do you mean the standing hip stretch?
Yeah.
Okay. Just want to make sure I wasn't thinking of something else. The second chair one says lateral flexion. Sorry. Okay. All right. So I think overall this program is looking good. We have parakeet. So what objective does that achieve? Because what did we want? Yeah, we want dynamic control of hip extension, you know, so you're not getting a lot of hip extension in parakeet, but you certainly want to have hip disassociation so that you don't arch your back as you extend out in parakeet. And and spine articulation, putting it kind of all together. And you can start with just a simple movement to warm up, and then the progression to the bridging, and then the progression to the full advance. So it could take you 5 minutes to get to the full advanced version if you're warming him up. Because even an advanced client needs to be warmed up, right? You can't just start with rollover and corkscrew just because they're advanced, right? All right, so breathing, which I think that might be a better starting place than the parakeet, because this one's so dynamic. So I think if I were putting them in an order, I would put breathing first. So that's a nice warm up for him, but doesn't necessarily achieve any of his goals. But that's fine. You don't have to have every exercise achieve a goal. But anyway, this one provides a better warm up, I think. So I would go with breathing first, and then parakeet, and then hip extension, which I think is a great choice, really great choice for him to be able to dissociate at the hip while he's in that position and improve that hip extension. Then we have mat leg pull, which you've done this on elbows, and now you're going up to hands, which I think is a good progression for him. And you're getting that hip extension in that push-up position. So I think that's great. And then side lift, mat side lift. He scored a 3 on that, but that may make him, feel confident. So maybe that might not be what he necessarily needs. We'll see if there's anything missing, as we said. Ladder barrel. So let's stay with this right now. So if you wanted to challenge him in that side lift position, what exercise could you do with him? Yeah, side kick. But how could you challenge him? Which I don't think by this point side kick's going to be very challenging for him. So maybe lateral flexion on the chair, which you already have, right? So that's okay. What else do you know that you might do on the side that's going to give him some challenge? Yeah, maybe sideline leg springs, and then he could do that earlier on, right? So that would be a better choice than something like parakeet or breathing, because that's going to give him that full range of motion of his hip, and you can really work on range of motion in the hip. So I would switch this to maybe long spring leg series. And then take out the side lift and give him another exercise to do. So if he only had one exercise to do as a home program, what would it be? If you could only give him one exercise, because we've got to put another mat exercise in there. It's right here. So that's awesome. That's a great, I think leg pull and swimming are great choices for him as a home program. I like that. Okay. And then ladder barrel, back to forward bend. Perfect choice. Super dynamic. He's got to be able to extend through the thoracic spine and bring the arms back and then go all the way forward again. So I think that's a great choice for him too. And it comes at a good time in the program. I like the ladder barrel bridging. And what goals does that one achieve? Thoracic extension and, you said, Cindy? Hip extension, yes. So that one's a good one. And then paired him by using gravity and the equipment before he goes into prone and does the ladder barrel swan. So the swan is perfect for him too, because he's got to be able to extend through the thoracic spine and reach the arms overhead. So that's a good one for him. The chair, hamstring 2. So where are we going with that one? That one's just a throwaway kind of exercise that's a transition between something else, because you don't want to give him like 400 extension exercises and no flexion, right? That he's going to hate that program. So I think this is a perfect choice to stick in there after you've done all this extension. Yeah, so it's going to feel good to him to be able to flex a little bit. And he also needs to know how to flex because he has that history of back pain. Doesn't look like it's a disc pathology, but if it were, he needs to know how to flex with control in that vertical position. So I think that's a fine choice based on that. You've got lateral flexion on the chair, which I think is a great one. It gives him an additional challenge to core control and shoulder stability in that unfamiliar orientation of gravity. And of course, you've got the swimming in there. That looks great. Semicircle on the reformer. What goals does that one achieve? I like it. It's got shoulder flexion.
It's got your hip movement.
It's got hip movement, hip mobility. Yeah.
Strengthening the core control.
What else does it have? Thoracic extension. Now, what do you think about it being here in the program, in the lesson? I think I would put it earlier. Yeah, I would put it earlier, although you've got all your reformer group together, which I like. But, you know, in a real world, I think that would be fine if you're grouping them all together. I would much rather see you stay at one piece of equipment than jump around. So if I had to put, I would put the whole thing a little earlier and then end with maybe the mat work. Something like that might work a little bit better if you just put it a little bit earlier and end with your chair and your mat work. Okay, but I like it in there. I think it's a good exercise for him. All right, and then you've got Reformer Mermaid, which I think is a good one for him to have in this level because of the upper body organization he's going to have, and the spine mobility, and the hip disassociation in internal and external rotation. So that's going to be a challenging exercise for him because it addresses a lot of his issues with the shoulder flexion and the hip disassociation. I like Reformer side splits in here too, because that's going to be upright against gravity and having good control of the lower extremities and the alignment in that abduction, adduction. And then standing hip stretch. So let's talk about that one. What do you think about standing hip stretch? Is that an advanced exercise? It's a good ending for a program. So it's not, he's not doing the hardest exercise last. Yeah, definitely addresses his upright running sort of postures and issues. But it's a little bit easy for this level. So what is it that you could do that's a little more challenging for him? You could do the front splits, yeah. Or, now that you know them, right? That's okay. So I just want you to think about what you would choose that's a little more advanced for him. It's not a bad choice, but what is it that we want him to eventually do? We want him to do high-level lower extremity alignment challenging exercises, right? So front splits is definitely one of them. Yep. The chair, forward lunge, or side lunge. Yeah. So I'd like to see that in there instead of this, and this could go over here maybe, right? Or somewhere in between the two, you know, in one of the lessons that's going to happen in between the intermediate and advanced, right? Again, it doesn't mean that this is exactly how you're going to deliver this program. There's going to be some segue in between the two, but we don't want to see that you're just jumping from one exercise to the other. Overall, this is a great program. So you did a really nice job. Just a few little tweaks that we would think about as we're putting it together. But I would say that if I received this program on the exam, you would pass. So, yay! Now can I say your name? Yay, Kate! That was great. And does anybody have any questions based on putting this all together? Was this helpful to think of it this way, as to think of where you're going and then how you're going to get there? I hope. But there's lots of ways to do this, and we try to give you lots of different options in how you put it together. All right? Very good. Thanks.